way or retire?
Okay, maybe just before I answer that question, I know putting on that, you're talking about the lead apron, you're trying to protect yourself and minimize the amount of radiation you're being exposed to.
Thank you very much.
But we have a principle that we call a LARA principle, as low as reasonably achievable. So you have to, and there are some three principles actually that are very important. That's time, distance, and shielding. So shielding actually comes last. So time, reduce the time that you spend near a radiation source. Because the more time you spend near the radiation source, the more radiation you'll be exposed to. So reduce the time. Distance. Increase the distance between yourself
and the radiation source.
Because as long as you're closer to the radiation source, you're going to get
exposed
to more radiation compared to if you're further away. And remember, you can't see the radiation. If someone brought a source and placed it under your chair there, you will not know that you're actually having radiation, unless if you have those, what I talked about, either the personal, you have to have equipment. You have to have equipment to be able to detect the presence of radiation. Now going on to the shielding, and that's now the third principle that I was talking about, time, distance, now the shielding. Now shielding is the last thing that has to be done after trying to make sure that you work on those first two. And yes, in hospitals this is normally used. Actually, you may not necessarily have to wear the lead apron, but if you've seen the workers that operate, for example,
the theater,
maybe in the theater. Actually, in the theater, they are always in the room.
I mean the cardiac, those high-end theaters. Yes.
So normally in theaters, because they are doing maybe a procedure, so the physician would actually be there with the patient. But look at scenarios where, for example, they are doing maybe the X-rays, the chest X-rays, the CT scans, or even the cancer treatments in radiotherapy. The workers will not always be in the room, but they will go somewhere in another. They have a control room, and then they are just viewing on a window,
on a screen.
Sometimes a screen, sometimes there's a viewing window that has lead shield,
just like the backside of this studio.
Exactly. So why is it? So they are trying to shield themselves, because remember, they are not patients. Before you're exposed to radiation, the benefit of the radiation to the person that's going to be exposed should outweigh the risk. So for someone who's being taken a CT scan, probably they have had an accident and they need to check their brain, they are justified. They are going to, the doctor wants to diagnose and find out exactly what's wrong with their brain before they give the appropriate treatment. So the justification for them taking the CT scan outweighs the risk of not taking it. Otherwise the person will die. You've had those people who have blood clots because they didn't probably diagnose something. So now for the workers, they stay behind in a control room because this is their day-to-day work. There's a certain dose limit beyond which they should not go over. Just like the member of the public. If you get to notice, most of these rooms have to be designed, probably you don't know that, but as inspectors we go and verify the rooms where these X-ray machines are going to be. They have to be well built, with certain thickness of the either the bricks or even the concrete, to make sure that in case they are doing the X-ray, the radiation is contained within that room. So the member of the public has also a dose limit. They should not go beyond 1 millisieverts per year. So we make our measurements, our surveys, to make sure that the person who is out there, who is not a patient, is not exposed to radiation. The workers who are helping this patient get fine, they are not going beyond their dose limit. So they usually have personal dosimeters. We usually call them TLDs. They put them on. So after 3 months, they return them to Atomic Energy Council, so we read them, so we are able to know how much dose they have absorbed within, for example, a 3-month period. So over a year, we are able to tell how much radiation they've been exposed to.
Wow. Allow me to say